81. During a multi-casualty incident, the first two arriving paramedics should assume which roles? A. Triage and treatment officers. B. Medical group supervisor and communications officer. C. Medical group supervisor and triage officer. D. Triage and transport officers. Answer: C. Rationale: the medical group supervisor will need to establish overall responsibility for the medical section, interacting with other lead officers such as police, fire, and public works. The triage officer will need to establish the number and severity of victims as early as possible. 82. All of the following are components of an incident command system except A. TRIA, B. Finance, C. Logistics, D. Command. Answer: A. Rationale: CFLOP is a mnemonic used to describe the components of an ICS system: command, finance, logistics, operations, planning. 83. Why are patients who present with pulmonary edema usually assumed to have had a myocardial infarction? A. An AMI is often the underlying cause of right heart failure. B. An AMI is frequently a common cause of left ventricle failure. C. An AMI decreases the oxygen-carrying capacity of the blood. D. An AMI can result in the formation of a pulmonary embolism. Answer: B. Rationale: myocardial infarction is a common cause of left ventricular failure, which is closely associated with pulmonary edema. 84. What is the primary goal of management for a patient with left ventricle failure and pulmonary edema? A. Decrease cardiac output. B. Initiate thrombolytic therapy. C. Decrease venous return. D. Prevent serious dysrhythmias. Answer: C. Rationale: the primary goal for patients with left ventricular failure and pulmonary edema is to reduce venous return to the heart, or preload, and thus reduce pressure on the pulmonary circulation. 85. Your patient is a 68-year-old male with a history of 2 prior AMIs. Your assessment findings include a pulse rate of 124, peripheral edema, and jugular vein distension. The patient denies any chest pain or breathing difficulty. What condition should you suspect? A. Left ventricular failure. B. Right ventricular failure. C. Pulmonary embolism. D. Myocardial infarction. Answer: B. Rationale: the patient's history, signs, and symptoms suggest right ventricular failure. 86. Your patient is an 82-year-old female with a suspected MI. While en route to the hospital, you note that her systolic blood pressure, which had been stable, has started to drop and that she is becoming confused. At the same time, her heart rhythm converts to sinus tachycardia. What you should suspect is happening? A. She is developing cardiogenic shock. B. She is going into sudden cardiac arrest. C. Pulmonary edema is causing heart failure. D. She has thrown a pulmonary embolus. Answer: A. Rationale: signs of cardiogenic shock include a sudden drop in systolic blood pressure and increasing confusion. 87. Your patient is a 65-year-old male who is complaining of pain in his abdomen, back, and flanks. His blood pressure is 90/60. On examination, you note that the femoral pulses are markedly weaker than the radial pulses. What should you do next? A. Palpate the abdomen gently for a pulsatile mass. B. Administer dopamine to increase cardiac output. C. Treat for hypovolemia and transport rapidly. D. Administer Lasix, morphine, nitroglycerin, and oxygen. Answer: C. Rationale: the patient is showing signs and symptoms of abdominal aortic aneurysm. Do not palpate the abdomen unnecessarily. Treat decreased tissue perfusion and transport. 88. Which of the following are signs and symptoms of acute pulmonary embolism? A. Rapid labored breathing and tachycardia. B. Slow labored breathing and cyanosis. C. Acute abdominal pain and anxiety. D. Pallor, chest pain, and tachycardia. Answer: A. Rationale: the most common signs of a pulmonary embolism, rapid labored breathing and tachycardia, are given. Onset is usually sudden, and there may or may not be chest pain. 89. Your patient is a 67-year-old female who complains of increasing leg pain and tenderness. The skin over the affected area is warm and red, and Homan sign is positive. Vital signs are unremarkable. How should you treat this patient? A. Massage the affected area to relieve the pain and restore circulation. B. Elevate the leg and transport the patient for further evaluation. C. Give 4 fluid boluses to treat the signs and symptoms of shock. D. Have the patient walk to the ambulance to promote blood flow. Answer B. Rationale. The clinical picture suggests deep venous thrombosis. The correct action is to elevate the leg and transport the patient for further evaluation. Do not massage the area or allow the patient to walk, since pulmonary emboli may be provoked. 90. In general, the court deems an emancipated minor to be one who 1. Is married. 2. Is economically independent. 3. Maintains a separate home. 4. Is in the military. A. 1, 2. B. 1, 4. C. 2, 3, 4. D. 1, 2, 3, 4. Answer D. Rationale. Each of the answers defines an emancipated minor. 91. What is the initial energy setting for defibrillation in an adult cardiac arrest patient? A. 100 joules. B. 200 joules. C. 300 joules. D. 360 joules. Answer B. Rationale. Initial attempts in an adult patient typically use 200 joules. This is gradually increased to 360 joules. 92. Carotid sinus massage is used for patients with which dysrhythmia? A. Non-perfusing ventricular tachycardia. B. Refractory ventricular fibrillation. C. Paroxysmal supraventricular tachycardia. D. Second-degree AB block, Mobitz 2. Answer C. Rationale. Carotid sinus massage can convert PSVDs by increasing vagal tone and decreasing heart rate. 93. External cardiac pacing is used for which of the following rhythms? A. Ventricular fibrillation. B. Symptomatic bradycardia. C. PVCs occurring from irritability. D. PVCs occurring as escape beats. Answer B. Rationale. External cardiac pacing is used to correct symptomatic bradycardias by directing the heart's electrical system. 94. What is the usual dosage and route of administration of diazepam given before synchronized cardioversion? A. 2 to 5 milligrams given intramuscularly. B. 5 to 10 milligrams directly into the vein. C. 5 to 15 milligrams by slow forepush. D. 15 to 10 milligrams administered rectally. Answer C. Rationale. 5 to 15 milligrams by slow forepush is the correct dosage and route when diazepam is used to relax the patient and cause amnesia before cardioversion. 95. Which drug is used in management of congestive heart failure? A. Dobutamine. B. Isoproterenol. C. Bertilium. D. Verapamil. Answer A. Rationale. Dobutamine is used in patients with congestive heart failure to increase stroke volume and in that way increase cardiac output. 96. Which heart sounds are normal findings on auscultation? A. S1 and S2. B. S2 and S3. C. S3 and S4. D. S2 and S4. Answer A. Rationale. S1 and S2 are normal sounds. Extra sounds are abnormal findings. 97. Which set of vital signs is suggestive of left ventricular heart failure with pulmonary edema? A. BP elevated, pulse slow and irregular, respiration slow and labored. B. BP diminished, pulse slow and irregular, respirations rapid but easy. C. BP diminished, pulse fast and regular, respirations rapid and labored. D. BP elevated, pulse fast and irregular, respirations rapid and labored. Answer D. Rationale. These vital signs, BP elevated, pulse fast and irregular, respirations rapid and labored, are consistent with left ventricular failure with pulmonary edema. Answer questions 98 to 103 on the basis of the following information. You respond for a 44-year-old male diabetic who is complaining of a general feeling of weakness. During your questioning, you learn that he has been constantly thirsty and hungry. His breath has a fruity odor, and his level of consciousness appears to be diminishing. 98. Which diabetic emergency is this patient most likely suffering from? A. Diabetic ketoacidosis. B. Diabetes mellitus. C. Hypoglycemia. D. Hyperosmolar hyperglycemic non-ketotic coma, HHNK. Answer: A. Rationale: these are symptoms of diabetic ketoacidosis. 99. Which vital signs would you expect from this patient? Aim: cool, clammy skin, bradycardia, increased respirations. B. Warm, dry skin, tachycardia, increased respirations. C. Warm, dry skin, bradycardia, decreased respirations. D. Cool, clammy skin, tachycardia, decreased respirations. Answer: B. Rationale: warm, dry skin, tachycardia, and increased respirations are common vitals seen in ketoacidotic patients. 100. This patient's symptoms are most likely due to which condition? A. High levels of insulin. B. Low levels of insulin. C. Low levels of glucose. D. Dehydration. Answer: B. Rationale: ketoacidotic patients have low levels of insulin.